Molweni, Sanbonani, Abshen, welkom aan hierdie geleentheid vir gesprek. Welcome to the many people who join us today from very diverse spaces and diverse communities to begin participating in a conversation we started on the 1st of October. Our construction of pride in the faculty has been one that we come very much in the spirit of humble listeners to this space, trying to construct a conversation whose future we have yet to determine, but one in which the voices that we hear will be significant in crafting that journey. We are gathering, we come to you, it's very difficult in a virtual space to decide exactly from where we come, but our location is on the slopes of the Hurikwacha mountain, Table Mountain. The Hurikwacha is the name given to it by the first peoples of this area. They recognized its gift as a space of healing and restoration. And again, it informs the spirit that we come to you this afternoon, very much mindful of the original peoples of the space and acknowledging the legacy that they leave for all of us. But Kamirodichais is the word they give to observatory. That is what the first peoples called this place. And their reference was to the place of the stars, an echo that you can see in the word observatory. And the place of the stars really doesn't speak to our egotistical rock star type of engagement with the world, but it's very much that as we come from the place of the stars, we acknowledge our part in a constellation of stars which continues to guide people through time, but also accompanies others in casting light into our world. When we come into the higher education space, we must acknowledge that it is a place of evolution. It is the place in which the identities we come with, sometimes partially formed, sometimes complete, but always nurtured by the process of higher learning. If we are not creating learning spaces in which we engage and continue to create cognitive dissonances, we will fail to educate people who will change our world from a global citizenship point of view. In a book called Learning as Transformation, Robert Keegan begins to construct this idea of how an adult academic identity may be formed. And he speaks about the idea that in the beginning our learning is instrumental, or our formation is instrumental, where we very much are transcribing what we know into the way we behave. And as we grow, we take on the socializing lens of the community with which we gather. And that's the case for universities in the gathering of their students. As we continue to learn and inform and allow the learning to transform us, Keegan argues that we get into a self-authoring space where we often determine the values by which we live. In the socializing lens, we are often determined by the values of those around us. But ultimately, and I believe firmly that the purpose of higher education must be to get people to the self-transforming lens, where through the various encounters with people who may not agree with us on anything that we say, yet what they say is valued in transforming the way we look at the world, the way we experience our learning, and our responsibility then to transform the spaces in which we live. And so this conversation forms an integral part, colleagues, of that space in which the faculty goes into a curricular transformation process. There are really three principles which will underpin how we engage with this social transformation, with this curricular transformation. And the first one is this idea of engaging with society. Whose voices will we listen to in the construction of a transformed learning environment? Who will we invite into the room? And more importantly, which people will we go out to meet in a society that is so diverse as we experience it? Will we go out to communities on the Cape Flats? Will we speak to the people in the rural plains of the Garden Route district? Will we travel up the West Coast to speak to the fishermen who will engage in how we form the healthcare workers that they require for a future that is free of disease? Secondly, we want to engage with this curriculum from the point of view of graduate attributes. What is the nature of the professional we wish to emerge from this space? How can we share with them our struggles with leadership and management and inform them how to be that in the future? How do we teach them to be collaborators, sometimes and often with people who are completely unlike ourselves? We may be called to collaborate in spaces that we're unfamiliar with. How do we give them the skills to do that? How do we ensure that in the naivety with which they come, having come from school often, how do we transform them into recognizing the opportunities for advocacy that are so crucial in the world in which we live? COVID has demonstrated to us so powerfully how the inequalities across the world are influencing the degree to which the world can control this pandemic. So the third part is social accountability. And when we look at things from the social accountability lens of what higher education institutions should be doing, what we're saying is that all of our graduates, particularly in the professions, must leave our space with the capacity to make a difference in the world. So when we are graduating South African doctors, we are saying primarily they must be able to deal with the problems that they encounter in the Western Cape, in the Republic of South Africa, in urban areas as well as rural areas, but they must in the first instance respond to what the South African community needs. And we must make no apology for that. We must say that quite clearly and explicitly, that we are graduating professionals who respond to the needs of the communities in our immediate locale. So colleagues, the way today will work is that I will introduce you to Savuka in a couple of seconds, and Savuka will then moderate the discussions this afternoon. So Savuka Machila has a decade of experience in civil society. They are a human rights champion advocating for the inclusion of marginalized groups, particularly where these marginalizations intersect at gender and socioeconomic status. That's a crucial nexus that we have found again and again in the determinants of health in society, the nexus between gender and the capacity for socioeconomic advancement. Savuka has a background in sociology and theology, having studied at Fort Hare and UKZN. And they're interested in exploring ways in which gender speaks to the lived realities of those who exist through contexts of structural violence. They're currently working for the Gender Dynamics as the Health Advocacy Officer and look forward to championing the rights of trans and gender diverse people in the community, in health and education spaces to improve overall well-being, with the increasing recognition of sexual and gender diverse communities. I'm going to hand over to Savuka Machila. Thank you very, very much, Savuka, for joining us this afternoon. And you'll guide us through the rest of the afternoon, and I'll return to make a couple of closing remarks, speaking to our commitment to this conversation not being a single event, but acknowledging that it will be a process going forward. Over to you, Savuka.
Thank you so much, Lionel. Good day to all the viewers today and the panelists involved. Welcome to today's webinar session, where we'll be conversing the converging spaces of gender and education. And particularly, I really appreciate your intro there, Prof, highlighting the need for social transformation and the role that education has for that social transformation. We realize that we produce a lot of graduates and a lot of professionals who sometimes might be a bit removed from the spaces that they occupy or the spaces that they work in because of how we've engaged understanding and knowledge accumulation and generation. And so to have a space where we interrogate what the synergies are and how best we can move forward with the idea of a holistic view of education in the higher education space and how that it can impact the social movements is quite an integral space, as education is a space where knowledge is produced and disseminated. So thank you so much for allowing me to moderate today's discussion with today's panelists who I have had the privilege of working with and knowing quite personally, and will be quite privileged to introduce them in today's session. So as I said, my name is Savuka Machila and my pronouns are they and them. And perhaps as a modus operandi, I would like us to introduce ourselves with our pronouns as well, so that we affiliate with the idea of beings with various pronouns able to be respected and understood through that lens as well. So I'd like to introduce my first speaker, who is Anil Padavatan. Anil will be speaking on creating a space for learning, lessons from the Gender Dynamics Gender Affirming Healthcare Training Program. And Anil is a health and human rights activist who has worked for many years in the field of HIV, human rights, and accessing to healthcare. He holds an honors degree in psychology from Rose University and has worked for various human rights organizations, including AIDS Law Project and the ASA HIV Clinician Society. Anil joined Gender Dynamics as a health advocacy officer in 2020 and is now currently the programs manager at Gender Dynamics. Gender Dynamics is the first registered African-based public benefit organization focusing on the transgender and gender diverse community. Gender Dynamics focuses on issues related to legal gender recognition and law reform, inclusive education, access to gender affirming healthcare, as well as other legal and medical issues impacting on gender and transgender diverse individuals. As a transgender man, Anil brings both a professional and personal perspective to their work, and his particular area of interest is in the realization of socioeconomic rights for all, which makes you perfect for this conversation space, Anil. Thank you so much for joining us. I would like to just introduce our second speaker first before handing it over to you to engage us with your presentation. Our second speaker is Dr. Anastasia Thompson, who will be speaking on the agency and autonomy in academics, a higher discussion of voice and identity within higher education and academic dissection of identity as a means to reinforce hierarchical power dynamics through the dehumanization of the diverse. So Anastasia Thompson, who is pronounced as she and her, is a medical doctor, author, and activist working in the field of human rights with specific reference to LGBTQIA+ communities, and especially transgender issues. She draws on both her lived experience and her professional experience in order to advocate for inclusion, access, and equitable justice for marginalized groups, and has recently headed the development of South Africa's first set of guidelines for the provision of gender-affirming healthcare, published in September 2021. Anastasia will be presenting on agency and autonomy in academics, a discussion of voice and identity within higher education, and the academic dissection of identity as a means to reinforce hierarchical power dynamics through the dehumanization of the diverse. Welcome to you as well, Dr. Anastasia, and thank you for joining us. We'll be having presentations from both our speakers, and later on open up the panel for any questions or comments that we have from viewers today. Please feel free to jot down any thoughts, comments, and questions on the chat Q&A, and then we'll engage it during the slot where we open up for questions and comments. So without further ado, I'd like to give it over to Anil Padavatan to give us his presentation. Over to you, Anil.
You're mute, Anil.
Okay, can you hear me? Can everyone hear me now? Right, my microphone is giving me an incorrect icon and it's showing me that it is muted when it is unmuted. So thanks everyone who's joining us today, this afternoon. I hope we're going to have a really interesting discussion. My apologies for the slight glitch at the start. As I hope we all know by now, Mr. Bill Gates is not, I repeat, not involved in a global conspiracy to microchip the population of the world. However, he is involved in a global conspiracy to produce software, which is not always the easiest to navigate. So please bear with me as I attempt to do this. So I'm going to be sharing a presentation now, I hope, Mr. Gates willing, And I'm going to be talking today a bit about the experiences that we've had as gender dynamics in conducting training for healthcare providers and medical students on gender affirming healthcare, and how I think we can take some of the lessons from that into other educational spaces, like our tertiary institutions. So please bear with me while I attempt to share my screen. Okay, I think that I'm going to be doing this unplugged because none of my icons are now working on my screen. So, the one last attempt. I think I've got a lag.
Alternatively, Daniel, you could share your presentation with me and I can see if I can share it on the screen on your behalf.
Okay, I'm not sure if any of our technical team also might have the presentation and might be able to put it up.
Garth or Melanie, do you have the presentation that can be shown?
It's sharing
on
now,
the screen.
Neil.
Okay, great.
Cool, good to go.
Perfect. Thank you so much, everyone. So my presentation today is Creating Space for Learning, Lessons from the Gender Dynamics Gender Affirming Healthcare Training Program. And as I said, I'm Anil Padavartan. I'm Programs Manager at Gender Dynamics. I am a transgender man and my pronouns are he and him. And we're speaking today from a pride platform. So I always, and I know Dr. Anastasia feels the same way, want to just put some context around pride. So pride is about human rights. It's centrally about human rights. It's about the right to equality, to dignity, to freedom and security of the person, the right to education, the right to healthcare, which are all basic human rights. And it's about communities like the trans and gender diverse community and all the other communities who fall under the LGBTQI plus umbrella, who have faced violence, exclusion, discrimination. And it's about stepping forward to claim our human rights. And that is essentially what pride is about. And that's what we're here in the spirit of today. And what I'm specifically going to be speaking about is about inclusivity in education, and how, when we're talking specifically about education in terms of the health sciences, how that intersects with the access to healthcare and what that means for our community. And one of the things that we know as the trans and gender diverse community is that we face multiple barriers in attempting to access both the healthcare system and in accessing education. Violence and the threat of violence are a major barrier. Bullying is a barrier. Fear is a barrier. Stress and the stress that comes with marginalization and discrimination is a huge barrier. And all of these lead to people not going into education, not completing their education, or having gaps in their education. And this has a massive impact on the socioeconomic position of the trans and gender diverse community. And as we know, there's no form of discrimination and marginalization that exists in isolation. And we're all existing in a context where we are, in our various ways, experience multiple layers of discrimination. And so in the South African context, people who are subjected to discrimination on the basis of their gender identity, who are discriminated against on the basis of race, who are discriminated against on the basis of their socioeconomic position, those people are then under the burden of multiple layers of discrimination, which once again impact on their ability to obtain an education. So I think we're, as a society, are all acknowledging and coming to not acknowledge that dismantling these barriers and combating discrimination is a more and more urgent issue that we are all facing. And I think this is something that the education systems within South Africa are grappling with, both in terms of basic education, in terms of secondary education, and definitely at the higher education level. Particularly at higher education, we're not just looking at how do we ensure that students have equal access to education and are able to all thrive and benefit from our education systems, but also how do we ensure that our curricula are going to equip the students that when they are professionals going out in the world, they are able to provide professional services to different communities in a way that is affirming and non-discriminatory. And this is particularly important for students of medicine and other medical disciplines, for students of psychology, of social work and teaching, because these are the disciplines that have a massive impact in terms of whether the people that they are providing services to are either able to access those services and access their basic human rights, or face further barriers and further hurdles to achieving equality. So we've seen in multiple ways people are grappling with this and looking at how do we ensure that, first of all, we have access in our campuses, and secondly, how do we ensure that our curricula are equipping our students for working with the communities who they are going to be working with when they go out there in the world. Because as members of the trans and gender diverse community, we are part of South African society. We are with you. We're not some group that is kind of outside of society. We are part and parcel of everyday society. We are the clients who are going to be walking through your doors as you're providing your medical services. We are the students and the children that are going to be walking into your classrooms if you're going to be teaching. And we are the people who you are going to be providing services to. Are you equipped to assisting us, or are you going to once again be yet another barrier to us obtaining the services that we so desperately need? So we're all, I think, united in knowing that we need to build awareness and we need to build more understanding. We need to reach across all the divides that divide us, the multiple levels of discrimination and marginalization that have existed in our society for so long, and build understanding, and from that understanding we can build the progressive curricula that we all want to see that will serve all of our communities. But how do we get this right? And I think we've seen a lot of grappling around that recently. And I'd like to offer one particular model that we use in gender dynamics as something that I'm hoping can inform some of the discussion around how do we start doing the kind of sensitization training, the kind of education that really has an impact in making this a real issue for students and something that they're then equipped to go out with and deal with in their working lives. And I wanted to start with a quote which I thought was a very helpful quote that a member of a support group that I'm with shared the other day. She is an academic at a South African university, and she received this message, and this is not a direct quote, but the message was along the lines of, "I'm really glad that I know you, because I've never met anyone who is transgender before, and it's very difficult to understand people in the abstract." And the woman who is a member of my support group shared this with the rest of the support group to say that this was she thought a really great message to receive from a colleague, because it really encapsulates what we're talking about when we're saying nothing about us without us, because it is very difficult to understand people in the abstract. And it's very difficult when you have got a lecturer standing up and giving you a module on something, for that lecturer to be talking about a community that they're not a part of, that they might not have direct experience of themselves, and then trying to impart understanding to students. It creates a very abstract learning environment, and one that I think is not conducive to the kind of human understanding that builds real knowledge. So in the as Gender Dynamics, for many years, we have been running a gender affirming healthcare program. In the context of COVID, we took it online, but we also have been at lower lockdown levels running it once again as a face-to-face program. And Dr. Anastasia, who's going to be talking to you later, is one of our trainers who we're very, very lucky to have as a trainer on the program. The program is aimed both at healthcare providers and at community members, and it combines sensitization training with an introduction to the provision of gender affirming healthcare. So it's really there to try to equip healthcare providers to provide gender affirming healthcare services to the community, and also to equip community members to better understand their own healthcare, so that they are able to take control of their bodies and of their healthcare and really participate as equal partners in the provision of healthcare. And the trainers that we have in our program are all healthcare providers themselves with significant experience in providing gender affirming healthcare. And they are all themselves members of the trans and gender diverse or broader LGBTQI community. And this is a crucial part of the training program. And so is the participation of community members in the training program, because, as we've said, it's very difficult to deal with these issues in abstract. But when we have got healthcare workers, whether it's doctors, nurses, medical students, nursing students, social workers, psychologists, occupational health practitioners, and any of the other myriads people working in the healthcare field who join these trainings, they're not just interacting with the knowledge on a screen or on a piece of paper. They're interacting with people who can talk about lived experiences and how they live their lives as real human beings. And I think that this is one of the big strengths of this training program. And it's something that we consciously do to ensure that people are doing immersive learning, where you are not just dealing with knowledge in the abstract and with theory, but with real human beings. And this then allows for an exchange of information that's based on human interaction. And if we look kind of at our core values as a democratic society in South Africa, Ubuntu is one of our core values, and that's really talking to how humans are humans based on our interaction with other people. And when we are learning, we learn much more from others than we do from a book or from a piece of paper. And for healthcare providers to be able to engage with real people and their experiences is far more powerful than any textbook or PowerPoint presentation or academic article can ever provide. And we also in our training program give all the participants the opportunity to think about their own gender identity and expression, and often it's the first time that healthcare providers are doing this. So when we talk about gender identity and gender expression, for those of us who are members of the trans and gender diverse community, it's kind of the air that we breathe, because it's been so much part of our lives from such an early stage of grappling with the sense that we have been assigned an identity and a role that we don't fit into. But I think the kind of difficulties that everyone experiences in very narrow gender roles, and the fact that the kind of central fact that everybody has a gender identity is not something that is very obvious to people who are not grappling with it in the same way that we do. So it's always a very interesting experience when we sort of open up discussions in our gender affirming healthcare training and we ask people, what was your earliest experience of yourself as a gendered being? When did you first realize that you'd been assigned as male or as female and that there was a whole gender role attached to that? And how did you feel about it? So for members of the trans and gender diverse community, we've all got our own stories of very early telling people, what you're telling me is not what I experience. This is not who I am. Whereas for a lot of the cisgendered participants in our training, this is the first time that they've had to think about this. And we often get some very interesting responses. A lot of people are just stumped and they say, I've never thought about this before and let me think about it. And we kind of come back to them at the end because they've needed some space and time to give it some thought. And some people start thinking through about how their gender, being assigned a gender at birth and the roles that come along with it have really shaped their lives. And they start to think about how their lives might have been very different if they had been born as a trans or gender diverse person. And a lot of people also share how, although they'd never really thought about it before, they found societal gender roles, or whilst they might very much identify with the gender that they're assigned at birth and have no discomfort around that, they find the societal gender roles very narrow and constricting, and might have battled with that sometimes silently in their own lives. And it's a very empowering space for people to start sharing knowledge and coming to grips with one of the central concepts around the complexity of what gender is, in a very real way, engaging with your own lived experience and the experiences of others. And so I'd like to suggest that the first step towards creating inclusive learning spaces is, perhaps obviously, the inclusion of trans and gender diverse persons in those spaces as trainers and participants, and not just as absent subjects of learning. And that human interaction in these spaces that deliberately challenges the power dynamics that we often see around educator and student, around doctor and patient, is the most effective way of breaking down prejudices and stereotypes, and is much more likely to lead to meaningful learning than a learning space that simply echoes the pervasive power dynamics. And so on that note, I would like to invite all of you who are in attendance here today to apply to join us online at the Gender Dynamics conference that we're going to be having this year. As Gender Dynamics, we regularly run national conferences on different issues that affect the human rights of our trans and gender diverse communities across Southern Africa. And our focus this year is on inclusive education. Our conference is taking place on the 20th to the 21st of November. And our information is available online. It's also available at our Gender Dynamics website, and I believe it's also going to be shared on social media through UCT. So we're looking forward to engaging with all of you at that conference. We're going to be unpacking a lot of the issues that we're just going to be touching on today at this webinar. So thank you all very much, everyone, for listening to me today and for being with us. And we hope that you will be joining us for our conference in November. Thank you so much, and handing back.
Thank you so much, Neil, for that engaging presentation. Really just situating us in a line of understanding the possibilities of engaging the lived reality, and how really such experiences aren't outside of our own, that in terms of understanding humanity, we really ought to engage people from a place where we can connect with them and relate to them, in order also to just undo the pervasive ideas of power that are intrinsic in various spaces that we occupy. So thank you for that presentation and bringing that context to us. Without further ado, I'd like to hand it over to Dr. Anastasia Thompson to give us her presentation. Dr. Anastasia presentation will be speaking on the agency and autonomy in academia. So I would like to give it to you, Doctor.
Thanks so much, Sovoka, and firstly let me thank my colleague Anil for some very important and very powerful sentiments. Let me thank the Dean for creating this space and opening the doors to this very important discussion. I'm not on mute, am I? Can you all hear me? All right, great. It's just one of those days out here. And let me thank everyone who's in attendance for showing up and for having this discussion and this dialogue. Savuka, you read out the topic for my discussion today, and I'll be honest, I don't even understand it. I wrote it myself, but I don't understand what I put down there. I'm not going to be boring any of you with a PowerPoint presentation today. And Neil, not to say that your presentation was boring, anything but. I will not be boring you with slides today. I will do my best to bore you without them. What I really want to talk about and focus on, and I'll echo something that Anil mentioned earlier, which is that, you know, we locate and situate this discussion that we're having during South Africa's iteration of Pride Month. And we have this concept of pride. And I feel like, to a large extent in 2021, pride is misunderstood. I think we need to make a concerted effort to stay in touch with the fundamental principles and values of what pride is, because so many times we see this rainbow washing, often corporate rainbow washing, where we put up a flag or we color in our logo. We see the parades and the floats and the ticker tape and the confetti. And it creates this idea that the human rights struggle for people in the LGBTQIA+ community is over. And in fact, it's far from it. We live in a reality, and you know, a testament to this is the fact that Anil has just spoken to you about all of the work that an organization like Gender Dynamics is doing in order to educate people on how to respect and uphold human rights. You know, we have this discussion that we're invited to by the Faculty of Health Sciences, and I want to believe deep in my heart that everyone who's a part of this faculty, as a student or as a staff member or as a leader, came to this field and this line of work and these career choices out of a desire to work towards and to promote the well-being of human life, to improve conditions for our fellow human being. I was reminded recently of an alternative to the Hippocratic Oath that I took when I graduated as a medical doctor way back in the day. And this was, I believe, incorrectly attributed to Maimonides. But you know, one of the lines in that oath or that pledge says, "Let me never see in my patient anything but a fellow human being in pain." And I think that often the fellow human being part of that gets lost on us. And this is really what I want to zoom in on today, and what I want to discuss in the admittedly very brief period of time that I have to do so, because I think we could speak on this for many hours and still not cover it all. But I feel like not only is the human rights struggle ongoing, not only are those human rights not as ironclad as they should be in this day and age, but I feel like they are under ever increasing threat And I feel like this is true in an even greater extent from academia. And I think that the reason for this is that we have certain institutions, individuals, role players who have co-opted the academic interrogation of identity, and they have weaponized it against people in the LGBTQIA+ community, especially trans folk, but all manner of queer folk. And they do it with reckless abandon, and often to great fanfare and public applause and acclaim and recognition. And worse yet, they market these harmful ideologies under a blanket of academic feminism, and they sell it widespread to the masses. These ideas that, and I will not mention individuals by name, but I will talk about the concepts, because it's the concepts that people latch onto, the catchphrases that are used. And I feel like we in academic circles have a responsibility to interrogate these narratives and these ideologies and these catchphrases and paradigms and buzzwords. And we have to examine them through our own ethical lens, our moral compass, a framework of human rights. We sit here in South Africa. The Dean opened by speaking about the rich cultural heritage of the mountainous backdrop against which we're situated here in Cape Town. And all of that comes down to these values that we all claim to uphold and to espouse, the values of Ubuntu, the respect for human rights and for human dignity and for human life. But then we take people's identity and examine it under a microscope and dissect to what extent it's valid or not. And I think that when we start talking about ideas like how trans women are not women, but trans women are trans women, when we start pushing back against language such as pregnant people, because we have to recognize in 2021, pregnancy isn't just about women. There are many women who will never experience pregnancy by choice or by circumstance. There are many people who will experience pregnancy, whether they are women or not. The language that we use when we try to be inclusive does not do damage to people. When we push back and we say that it's wrong to talk about pregnant people, people who menstruate, that it's wrong for us to be inclusive, we spread the idea that we're taking away, by protecting the human rights of a marginalized group, a group who has suffered a legacy of prejudice and discrimination so often enforced by these hierarchical organizations. We're as guilty as anyone, as clinicians, as medical doctors, we're guilty. We've poked and we've prodded, we've been at the helm of conversion therapy with paddles and electrodes and all kinds of things, we're guilty. But we have a responsibility to undo that. We have a responsibility to recognize that human rights does not play second fiddle to academic discourse. So when we talk about the language and the way that we refer to things, and we step away from being inclusive because we feel like the institution or the people who hold the power and the privilege are being threatened, they lose something in this process, we reinforce this false narrative that human rights is a finite entity. See, I should have had a PowerPoint slide, then you'd see the pie. It's not a finite entity that we all have to grab a slice, that we have to squabble over it. There's a finite amount of human rights, and if we give them to the trans people, we take them away from the cis women. Because that narrative serves to pit the marginalized against one another. And it diverts our attention from the actual wielders of systemic power who have wielded such for generation upon generation. And while we fight amongst each other for our slice of the human rights pie, we do not make progress. We don't move towards a situation where everyone is better off, because we need to say that fighting over scraps is not good enough. We need to say that everyone has the right to dignity, respect, freedom, autonomy, and that by protecting or upholding or promoting or safeguarding the rights of one group, we refuse to do it to the detriment of the other. When it comes to the academic discourse, I think the problem is to a large extent one of representation. And the previous lecture or panel discussion in this series, Nothing About Us Without Us, encapsulates that idea, because there is a power dynamic at play. When you look through a lens, a microscope, a magnifying glass, when you examine the subject, when you subject the queer person to study, you also dehumanize them. You make a spectacle, like a circus animal, or an exhibition in a zoo, out of a human being. But we should recognize in 2021 that the queer folk are here. We have voices, we have experience, we have skills, we have training. Some of us are more visible than others. I'm visible. That's a manifestation of my privilege. I can be visible. I can say, here I am, a doctor and a trans woman, and I can challenge your ideas because I have a degree of safety that is given to me by my socioeconomic status, by the neighborhood in which I live, by the color of my skin. There are many more whose voices have not been amplified, but who are out there. We have a responsibility to make it safe for them and to empower them. We have a responsibility when we conduct research, when we enter into academic discourse, to say to ourselves, how do we ensure that we are not looking through the microscope at a group of people, but that we're empowering people who historically have been disadvantaged? We are empowering this group of people to be heard for themselves, to define and to enter into the discussion and the discourse around what identity is. And I don't think that we have an excuse not to do it anymore. Gone are the days when it is acceptable for a group of cisgender, straight people to lead the discussion on queer identity and to pass it off while doing so as upholding human rights. We're here. All you need to do is listen to our voices. And it's not something that I'm imploring you to do because it's the right thing or it's good or it's generous. I say to you that it is an ethical imperative and an absolute responsibility to interrogate who is at the table, whose voices are being heard, what we are discussing. It is those who hold the power who must now be held accountable. So that is my message for Pride. And I thank you again for having this discussion. I think that we've raised so many interesting points for ponder and for debate, but I hope that those points for debate will never include whether someone has a right to their identity or whether they are entitled to respect, dignity, and human rights. Because I think, and I hope, and I pray that we should all be able to agree that those are indisputable. So Vuka, I'll hand that back to you.
Thank you so much, Dr. Anastasia, for that moving presentation. Speaking really to the power dynamics that do infiltrate the academic space and speak onto marginalized groups instead of speaking with marginalized groups. And I think it's quite a profound engagement, I think, that can open to discussion. We might have a few minutes just to engage one or two questions. If anyone has a thought or question or comment that they'd like to share, please pop it into the chat so that we can engage that question while we still have the time. Someone has shared on the chat, Dr. Anastasia, that those were quite powerful words. So they're quite moved with that. Thank you. I think perhaps I can also start with a question towards you, Dr. Anastasia. That how do you perhaps create a space where we can empower those who are marginalized to hold people in power accountable? And you mentioned something about the systematic power or systemic powers that infiltrate the academic spaces, and often than not, one who speaks back to that needs to be either on the ethics committee or have a commentary or paper that responds directly to certain notions that are publicized or shared in that space. But how do we empower the people on the ground, whether that be students, whether that be community members, to respond to that and perhaps shift the thinking around and the conversations around those type of discourse?
I think that's a very insightful question, Subuk. I think it's a very important question. It's a difficult one to answer, and I think the reason for this is that if you have ever been in a space where the validity of your being is being discussed, it is an incredibly violent and traumatic experience. And if you're listening to what I'm saying and you cannot relate to those words, they do not resonate with you, then that tells you that you are in a position of privilege to have not lived through that experience. And I think we always say, you know what, there's activists out there, there's the queer folk who do this professionally. I used to joke and say, I'm a professional trans woman. It's what I do in life, because sometimes it feels that way. But it comes at a cost. There's a toll to that. It's difficult for us to keep putting our flesh on the firing lines. You know, we have the skin in the game. And I think what's important here, I think this is where allyship has a role. I think this is where people who have that privilege of never having had to stand by and listen to the validity of their existence being discussed by a group of experts, I think this is where you come in. I think this is where your voice can be heard and you can stand up meaningfully for people in the community. The second thing that I'd say is that I think that there has to be a concerted effort to start creating opportunities for queer folk within academics and to do our utmost to ensure that those opportunities and those positions are filled with queer voices. You know, I think this is part of this process of transformation, again, alluding to what the Dean said at the beginning of this discussion around transformation. We haven't had it right for however long, but we have an opportunity now. We need to figure out the steps in the process, however long it takes, to ensure that we're moving forward. So I'll thank you for that insightful question.
Thank you so much, Dr. Anastasia, for that packed answer. I do have another question, and I'd like perhaps to direct this one to Anil, who did speak about the ideas of bullying and fear and violence really being some notions that plague trans realities and perhaps prevent them from expressing themselves and maybe even occupying spaces. And so in UCT, for example, what can be done perhaps to facilitate a space where inclusivity for trans and gender diverse people is possible? I can also share that it is quite important to understand access. So what would that equal access perhaps look like in a space like UCT, where we say, okay, we want people to engage a space without fear of discrimination, prejudice, etc. So I'm amalgamating the question or comment from Wendy, and the idea of what would equal access look like that will inform a space that can house gender and trans people within the spaces, and perhaps even speaking to registration, evolution facilities, etc. You're on mute again, Anil. Sorry about that. Do you mind unmuting? Try muting, perhaps that will work. Try it. Can you say something, Anil?
Okay, am I on yet?
Yes, you are.
Can you hear me? Excellent. So, sorry once again about my technical problems. So thanks for that question. And I think that's a very important question, because as Dr. Anastasia so rightly said, we're talking from positions of relative privilege because we're people with degrees, and as a white middle-class middle-aged man, I have in no way experienced the kind of multiple layers of discrimination that so many other people have, and the barriers are very, very real. So I think some of this is big systemic issues that we need to look at kind of as a nation. First of all, access to tertiary education begins at basic education level, and where kids are subjected to years of bullying, where they are not able to access mental health care, where they're not able to access support for their gender identities and affirmation in childhood, and then in adolescence, it's very, very hard to then go on to access tertiary education. It's hard to just get in the door. It's hard to pass your exams. And whilst I haven't experienced some of what so many people in this country experience, my greatest barrier to education was the fact that I was self-medicating with alcohol from the age of 14 to try and cope with the crippling gender dysphoria that I was living with from going into puberty. And I basically wrote matric exams and university exams in a state of constant hangover. And I don't know how I got through. And that is a reality in the lives of so many young trans and gender diverse persons, is that there's no mental health support, there's no information, and we're just trying to get by and live with a kind of difficulty that I think a lot of people don't understand and appreciate. And then you compound that with bullying, you compound that with lack of access to resources, and you compound that with the fact that for a lot of people, the way that you access education is through your extended family. So for most people in South Africa, the only way that you're accessing education is through financial support from your extended family, because the state support is not sufficient. Bursaries are not sufficient. We know that we don't have enough money supporting students from disadvantaged backgrounds. And extended families pull together to push their family members through into education. But so many young trans and gender diverse people lose that extended family support because there's no understanding in our communities of why this person is different from their cousins. And they're the ones who lose support, and they're the ones who don't get the support to go into the academic spaces to start with. So we need to look at big restructuring of how we look at who are the most marginalized people in our communities and how we can get resources to them. Once you've jumped through all of those hurdles and you're now on campus, we need to look at, are our programs that are dealing with mental health support, Are they accessible to trans and gender diverse students? Are they speaking to trans and gender diverse students? Are programs that are dealing with gender-based violence on campus? And we know that we've had such a focus on this, and rightly, because of the gender-based violence that women in South Africa are experiencing. But are those same services available to trans women students? Are they accessible to trans women students? Are trans women students excluded from those services? Are those services available to trans masculine students who are being targeted by virtue of having female anatomy, or by virtue of being seen as people who are stepping outside of society's gender roles? Are we really inclusive of non-binary identities in the way that we are providing our interventions on addressing gender-based violence? When we're providing healthcare on campus, are those spaces affirming? Can students access their sexual and reproductive rights on campus, at campus clinics, when they are coming from trans and gender diverse communities? And this is I think these are some of the questions. Are our reses inclusive? Are students afraid to come out and speak to their lecturers about their gender identities? And I know that they are fearful. And when I'm talking about fear, I'm not talking about theoretical. I'm talking about in the support groups, the online support groups that I'm part of, students posting messages saying, I really want to tell my lecturer that the reason why I've been struggling with this assignment is because I've got my own trauma, and it's speaking to my trauma and making it difficult for me. But that would mean talking to the lecturer about the fact that I'm trans. And should I do that? Would I be okay? Will I get a bad mark and then not know whether it's because I came out or not? And these are the real fears that students are expressing in support groups. And so we need to look at creating those safe spaces and really looking at, are we giving enough resources to students that are the most marginalized, particularly trans women of color, particularly students of non-binary identities that are so excluded that they often feel that they don't even have room to speak at all. And I think that's very important. What Dr. Anastasia was saying is, when you're looking at any room, who is not in the room and why are they not there in the room with you? Thanks so much.
Absolutely profound. Thank you so much, Anil, for that. And thank you to both our panelists for sharing their insights and experience in terms of what can be done to transform the education space to be more inclusive, more aware of gender diverse and transgender issues. And really, I think it does call upon us who might have some type of power or some type of situatedness to inform and influence the type of change that's necessary to make space, to create forums, to create policies that speak to these type of issues that need to be addressed. Because as we move, education seems to be a platform where we can engage transformation within the space of education and without externally in the social space. So I'm really happy that we could have this conversation. Very sad that we are cut for time. An hour is never, ever enough to have these conversations. And so I perhaps implore UCT to open a bit more of these platforms, perhaps involve perhaps some of the students to share some of their experiences and what they might think would be possible in terms of transformation within the space of universities. But now that is a start, I think it's great that we have had such a wonderful jump start to a particular process that could be really emancipating to everyone involved. So thank you so much, UCT, for opening the platform, and I'd like to hand it over to Lionel to give a word of thanks. Thank you.
Kaisikai Gangans. That's the way in which the original peoples of this area express profound gratitude. Ke Gangans. I want to thank all three of you, Savuka Machila, Anastasia Thompson, and Anil Padavatan, for really an incredible start to a conversation I suspect will be a long time in its development and formation. So thanks very much for your contributions today. Perhaps I want to take three lessons out of it, and I really want to acknowledge the the chat room, which has become alive in this last minute or two, and acknowledge the questions that people are asking. We'll try and retrieve those and integrate them into the conversations we need to have as a faculty. Perhaps there are three things that I want to highlight today that I've heard in this conversation. It's the affirming for me of our transformation framework of the faculty, our faculty transformation framework, which was constructed around the notions of power, identity, and knowledge. And really all of your comments today have reinforced the notion of how those intersect so powerfully in the higher education space. So thank you very much for highlighting those. In Anil's talk today, the message that I'm taking away is that paraphrase quotation that you used, Anil, I'm really glad I know you. Because I think that's often the plea of all of those students who come into the higher education sector. And for the trans and gender diverse communities, I suspect is even more powerful. Because it is our responsibility that we make our students known and make them know the diversity of the communities that they will be called to treat in their vulnerability. So that's quite an important thing for me. And then the notion, Anastasia, that you kept repeating is this indivisibility of human rights, the infinity of human rights, and this concept that in a world where everybody has rights, it doesn't mean that some rights are undermined in order to establish them for another group. And that's a concept that we need to continually bring into our conversations. And I want to pick up Mark Hendricks' comment from the chat about our continual interrogation of who is at the table. And what we've done today is say this table is open. The number of times we create in the future for our gathering around this table is really something that we need to build on as a faculty, and you would certainly be welcome to return at any point for that conversation to continue. Savuka, I think you're absolutely right about an hour. Perhaps this is the hour that begins a day-long conversation that lasts well into the future. I want to thank the attendees. I want to thank Melanie, Linda, and their teams who've put today together, and really to Garth and his team for holding the technology together for us today. Kaisikai Kangans, and everything of the best in the future. Thank you.
Oh.
Colleagues, thank you.